Diabetes issues for children and teenagers. If you suffer from diabetics and want to live a normal life, click the link in the description for your free guide. Many parents worry when their child with diabetes starts or returns to school. DHHS. A gateway to the strategies, policies, programs and services delivered by the Department of Health and Human Services. Seniors Online. Victorian government portal for older people, with information about government and community services and programs. Contrast sign up. Search type a minimum of 3 characters, then press up or down on the keyboard to navigate the auto-completed search results. Reactions to a diagnosis of diabetes. A child or teenager newly diagnosed with diabetes will have a range of reactions and emotions. Common reactions experienced by children and their parents include shock, denial, anger, sadness, fear and guilt. These feelings usually subside with time and appropriate support. Common responses to a diagnosis of diabetes include anxiety about the condition, fear of needles and multiple injections, a feeling of being overwhelmed by injecting and other tasks that need to be performed daily, frustration over fluctuating blood glucose levels, feeling different, fear of experiencing hypoglycemia, low blood glucose. Potential symptoms include dizziness and fainting in public, embarrassment about their diabetes and their friends' possible negative reactions, difficulty coping with the emotional reaction of family members. The period immediately after being diagnosed with diabetes can be challenging. Emotional support offered by friends, family and a diabetes healthcare team can be very helpful during this time and can improve the way children or teenagers cope with their diabetes. Children and teenagers coping with diabetes. Living with and managing diabetes every day can be a struggle. Children are commonly concerned about feeling like they are a burden on the family, being treated differently or delicately, as if they are sick, coping with constant parental questions about their food intake, how they are feeling and whether or not they have taken their insulin, getting extra attention from parents or others, which may cause jealousy among other siblings. It's normal for children or adolescents to feel sad, angry and fed up with their diabetes at times. After all, diabetes is a lifelong condition, so the tasks and skills needed to manage it must be continued over a lifetime. If children struggle with their diabetes management due to feeling depressed, anxious or overwhelmed, it is important to seek help from your diabetes healthcare team. A social worker or psychologist can help. In some cases, the involvement of a psychiatrist may be necessary. If you suffer from diabetics and want to live a normal life, click the link in the description for your free guide.